The intent tonight was to give you a little bit of a peek behind the curtain based on what we heard from the governor yesterday, and also some anticipated updated information we would get from county health based on that. As you know, it trickles down. The governor makes a motion or makes a recommendation or puts an order in place, and then county interprets that and trickles that out to us at this lower level. And the governor was very specific about he did not believe there should be a one-size-fit-all approach, that local jurisdictions and counties should look at their specific situations and interpret what he was saying to their benefit. That being said, we didn't get a lot of feedback today from county health, I think specifically because they're waiting for the governor to clarify some of his comments. For instance, he made some recommendations about opening businesses in this first phase that, quite frankly, a lot of folks I don't think anticipated happening, and he said there would be more information to come, and it just hasn't gotten to us yet. At the city level, what we anticipate to do is following a lot of the same steps we've already been preparing for, a lot of the same stepped down process that the governor talked about, that the county health is preparing for. That means next week when business opens back up, for us, it's not going to look a whole lot different than it looks today. What we're going to do is have identified some key managers and employees that are going to start working on those transition plans, and they're going to be really fluid. They're going to be really agile because we know this situation has the potential to change on us. The focus for that first phase is going to be about figuring out how we bring employees back, how we maintain operations at this current level and enhance them, but that doesn't mean bringing everybody back at one time, clearly. And we're going to encourage managers to take a creative approach. We really want to identify the folks in this last month and a half for whom customer service support has not been ideal for them. This technology-driven platform works for a vast majority of our community. Our community is pretty high-tech, pretty savvy that way, but doesn't work for everybody, and it's not necessarily the best service model for everybody. We want to make sure we bring all those folks back up to that full service level that they're used to in a platform that they're comfortable with. So there's a lot of work being done on that. We want to focus, again, on letting the departments step back in based on where they're at. For instance, we know community services, parks and recs, those summer camp programs, they're not going to step back the same way some of the other service areas are, such as utilities or police, who pretty much, although there's been some customer service changes, for the most part have been able to keep their operations going just like they always do. So again, helping those other departments look at how this is impacting them uniquely, and then drawing up plans for a transition that fits them. So we're still a little bit in a wait and see mode, although we think we have a pretty good idea. We're trying to build out our future transition based on the phases that the governor mentioned yesterday. But again, we want the public to be really understanding that this is fluid, that there's going to need to be some agility on our part, some understanding on their part. And we're also working to that end on a communication plan where we can maybe give the community a little peek ahead as to what we anticipate as we step through these different phases. So that's short and sweet because I don't need to give you more info that I don't have.
Thank you, Jim, and appreciate all that you're doing. I know it's been changing regularly, and appreciate your involvement out of the Emergency Management Office. Council members, any follow-up with Jim?
Maybe not for Jim, maybe it's for Darren, but I have someone who, I know we have these updates at council every Tuesday, and I know we have a web page that's designated for information about COVID, but is there any way for people, because everything's so fluid and, the messaging changes from day to day, is there any way, where's the best place for people to get updates about what's changed in the, kind of past 24 hours kind of thing? I know people were concerned about what our exit strategy was from Heritage Park, for example, and I think we don't have that. Where would people go to find kind of daily updates or more, or is that updated daily on the website?
Jim, do you want to speak to that?
Sure, I can just shout at that. Councilmember Stevens, I wouldn't say that it's updated daily. There's a lot of nuance that goes on day to day. We do try to push out some regular messaging through our CPIO office as to significant changes. what we're currently doing is a good example. The last couple of weeks, we've found ourselves in kind of an operational groove where there hasn't been a lot of new information to put out for the community at large, and so we've been handling those specific requests as they've come in. One of the things I did mention just now, though, is we did talk today in one of our focus groups about how can we reassess what's happening every Monday for our group, and therefore Wednesday push out something to the community so that they can anticipate change coming down the pike. And I think that's really what the community is looking for, is as opposed to we get a press conference Monday and Tuesday we're all trying to figure that out. How can we give them some lead time to these changes that we are trying to forecast ourselves based on that?
And Mayor Pro Tem Stevens, our newsletter is updated daily. So I would encourage, the best spot for information if you're online is fcgov.com, and you'll see a button for coronavirus. You can say fcgov.com/coronavirus, but I think it's a good daily update. And I will tell you that, and I just got that information from Amanda King, or when Jim used the word CPIO, that's Communications Public Involvement Office, and they do all of our social media, fcgov.com, Channel 14, and really the complete gamut of our communications work. But right now, I would say the best place to go is to that online newsletter. If someone does not have electronic access, then what I might suggest is they call my office at 970-221-6505, and we will figure out a way to make sure they get those daily updates. And we'll figure out a way to get that, whether it's a fax, whether it's a quick phone conversation, whatever. We can make sure that we get them that information if they're not electronic. Okay.
Thank you, Darren.
Yeah.
And
Thank you.
Yeah, thanks. And Darren, if we have a lot of people reaching out and wanting to help, and there's Adopt a Neighbor as one program, but also there's a lot of organizations that are trying to help provide meals, that sort of thing. And what's your suggestion of who do they contact to help coordinate or at least point in the right direction?
Well, our standby mayor is the Adopt a Neighbor program, as you've suggested, at fcgov.com. We've also suggested people contact and go through United Way County. They're a great source.
Thank you. Appreciate that. Any other council members regarding the staff report?
Yeah, and thank you for the information. I know this is really early understanding how the statewide orders are evolving. I guess one thing I would encourage, Mayor, you and the city manager, as you have your regular contact with the governor, would be, I think we need to make sure that the state is staying in control of the message that this really isn't rescinding the stay-at-home order. This is a modification of the stay-at-home safety measures that we've been taking. And because what I'm concerned about, and I'm hearing a lot of constituents that are concerned about this too, is that people might misinterpret this as anything goes, when in reality it's not anything goes. So I think there's going to have to be a lot of message discipline repeatedly to try to emphasize that, this is a modification of our stay-at-home order, because there is actually a request, at least, to have vulnerable populations stay at home. So trying to push that message that, yes, we are modifying it. Yes, we're allowing 50% of offices not to stay at home if they feel like it, if they meet some other requirements. But really, it's a modification, not a rescinding or a repeal. I think that would be one thing. And then the other is just continue to focus on testing rates, looking through some numbers. Colorado's per capita testing rate is in the bottom quartile, and would love to have some more dialogue about how we can fix that, improve that, whether it's from federal action, whether it's from local action, whether it's from public-private partnerships or CSU, CU, UNC, public-private partnerships, whatever it is. I think that it would serve us all well as the summer continues, be able to radically increase the amount of testing, as Tom Gonzalez said when he met with us last time. The dramatically increased testing and contact tracing is the gold standard, at least until we get some more effective treatments and or vaccine. So I just wanted to add those things, but I certainly appreciate everything that we're doing. I know it's early on the statewide order. We'll have to see how everything evolves, just like everybody else.
Yeah. Thank you, Ross. And I wholeheartedly agree with what you're saying. I'll just share with you, yesterday I got 2 phone messages in a short time frame. And one was, why are we having to stay in place? And that's crazy. And, we should, that should be lifted and for this, that, and the other reason, that sort of thing. And then the next message was, we need to stay in place even more and for protection and of the lives and so forth. And I think that's that to me, that just illustrated the spectrum. And the fact is, and you described them, is, staying at home and staying in place is the necessary practice now. And if you look at Larimer County, I think we've in Fort Collins has been doing the right thing by doing the social distancing and staying at home and avoiding the contact, and that will be the practice and covering one's face and so forth for the foreseeable future. As this discussion continues as relates to stepping down, as Jim calls it, and how that will happen, it's imperative upon all of us in order to continue to practice the physical distancing, the small groups, the staying safe at home is very important. And that will have to be our norm for the foreseeable future. As our businesses begin to open and practices are in place that allows for to protect from the spread of the virus, that will also be in place as well. So it's all important. So I appreciate that. And Ross, with your comment also about testing, and that has been a recent drumbeat for the last 2 weeks that we've made with regards to as we begin to move into more recovery. In order to be effective, there will have to be a large degree of testing. We've facilitated conversations between the Larimer County Public Health and Colorado State University, where they have a number of labs. In fact, in a conversation with Governor Polis, changed the regulation that enabled some more testing to be done utilizing facilities at Colorado State University as just one example. And there will be other conversations that we're having to actually hopefully to do some broader community testing in Fort Collins for the antibody and other sorts of things. So completely in agreement that we need to get more testing here in Fort Collins and in Larimer County, and we're working with the Larimer County Public Health Office in doing so and making the case to both the governor and to Representative DeGoose and our 2 senators on literally a weekly basis. So they're hearing from Northern Colorado, hearing from Fort Collins, and hearing from us. And so I think that's an important part to emphasize, that we're actively engaged in these conversations as it relates to the testing, the legislation, and how the implementation for the stepping down will be occurring. So thank you for reemphasizing how important that is for our community.
Yeah, I just wanted to say that I have been receiving a number of emails, constituents who are concerned about the exit plan for Northside Aslan Center and the tents. I know the number of tents are growing. People are acutely aware of that, and so and I realize that the plans are evolving, but the sooner that we can get that out to the community so that they can see that it's not a forever thing, but in fact will come to an end with with a logical exit plan. I think they would be very pleased to know that. So the sooner the better there. Thank you.
Thanks, Susan. Darren, did you have something?
Yeah, just to respond to Councilmember Kotowski real quickly, we are in a position, and we have shared publicly what we're calling sort of our exit strategy. We've not given the several page details about the interactions between, the Parks Department and police services and sustainability. But I think our general plan, I'm happy to provide that. And in fact, that is a question that we continue to get. So maybe that's something that we should put on our coronavirus page. I know, that's a topic that's a real hot topic for a council member and your constituents. And so we've spent a lot of time on that. I feel good about the plan. Just to add a little bit, I know council and the mayor and myself and our staff are very well aware of what's going on inside the building and going on outside the building. Admittedly, it has been a challenge for us, but I think having that plan is important. And so I'll be sure that we add that to our fcgov.com site, and then also make sure that council has adequate information to be able to respond to folks who are saying that. The other thing I wanted to just mention is, and to add to what several have already said, Mayor and Council, as an employer, as one of the largest employers in this community, I also think we have an opportunity to lead by example. And so, as it relates to the physical distancing that we're talking about with our colleagues at the city, I think about teleworking, which all of us as council and most of my executive team, many of us have not been in a city building for well over a month. I also think about public access to our municipal buildings. I was asked that question by the county manager earlier today, and what our plans are. We're going to continue to operate as a virtual city with some of the essential outward-facing services. We'll continue to provide those, but my expectation, as the governor talks about safer at home, I know council believes that, and as the board of directors of this city organization, I take your feedback regularly. I want to support that as well. Our manager, Jim, and our various executives and managers. So, you should be seeing city employees wearing masks. You should be seeing them physically distancing. You certainly have many of our workforce that are teleworking now. And candidly, as I've looked at the services that the city provides, I've been very impressed with our ability to continue critical business functions, and functions that are not critical in most cases. So my point in all this is to say, until I hear otherwise from you, council, we're planning on leading by example as a large business in Fort Collins. And so I'll continue to report to you on how we're doing in that space. But so far, I think the city is as a large business is doing everything that to honor both the governor's requirements, and we haven't talked a lot about the county health director's requirements. So we're watching closely to see what he does, and the other advisors that we've counted on since day one.
Thank you, Darren. Any other council members?
No, I just wanted to mention, in listening to Governor Polis's comments, I appreciated him, his statement. He said, now's the time not to be fearful or anxious, but cautious. And I thought that was a good reminder to everybody, that, we're going to continue to exercise caution. We need to do that by those who are most vulnerable, extending on their own the stay in place, protocol. But for those who do start getting out and get back to work, being prepared for the adjustments that, need to take place to exercise the appropriate steps of caution. So, I think they're just so important right now, because there's a lot of anxiety and fear that that isn't helping people, deal with the issues at hand. And so, you know, we're going to continue to, you know, exercise caution. We're going to continue to follow the lead of health experts, but we also need to be taking care of, you know, those who need incomes to pay rent and buy food.
Thank you, Ken. Anyone else? Thank you. And we'll, as you can tell, this is an issue on everyone's mind, and clearly the City Council. And appreciate the city staff and Darren and all the things that that you're doing and we're doing within the community. Clearly, a lot of this is focused on the virus itself, and you know, and can't forget and to keep the hopeful optimism looking forward as we move into recovery. But this is impacting everyone in one way or another, and as we think about that, I think there's a lag period with some of the impacts as it relates to our businesses and our individual situations and others. And so now more than ever, we need to be supportive of each other, and also recognize the fact that there's many things that we can do to help each other, and also be aware of those things that are available within our community, that we can bring to bear on some of these challenges at this time. So thank you all for your comments, and Jim for your presentation, and Darren for your comments as well.